Hi, I'm Min Kocher from the Department of Orthopedic Surgery at Boston Children's Hospital and Harvard Medical School. This research is coming from the Division of Sports Medicine and the Hip Preservation Unit at Boston Children's Hospital. Hip arthroscopy is exploding in terms of utilization in the orthopedic community. We know that articular cartilage status is the most important predictor in terms of outcome after hip arthroscopy. Patients with intact articular cartilage in general have good results, and patients with articular cartilage lesions and arthritis often have less superior results. In the adult literature, this has been well shown, but has not been looked at in the pediatric literature. I think the thought is that pediatric adolescent patients don't have much articular cartilage loss, and therefore we would not see a lot of articular cartilage lesions. In our experience, though, even patients 18 and younger, we've been seeing articular cartilage injuries, and to us this has seemed to predict their outcome after hip arthroscopy. So the goals of this study were to document the prevalence of articular cartilage lesions during hip arthroscopy in children and adolescents, and also to look at predictors of cartilage lesions in terms of demographics and imaging findings. In this study, we looked at 446 hip arthroscopies in children and adolescents aged 18 and younger. Our main finding was that 21% of these patients had articular cartilage injury. That number was quite high. 1 in 5 patients, even 18 and younger, will have articular cartilage injury. In terms of demographic predictors of articular cartilage injury, we found that older age, male sex, and higher BMI were associated with articular cartilage injury. In terms of imaging, we found that cam femoral acetabular impingement, as indicated by a higher alpha angle, was associated with articular cartilage injury, whereas pincer impingement with acetabular retroversion was actually inversely associated with articular cartilage injury. I think the significance of this work is that it gives us a sense, first of all, that articular cartilage injury is not uncommon even in younger patients, 18 and younger. This may make us want to address impingement and labral tears at an earlier age in an effort to try to stem or minimize these articular cartilage injuries. It also helps us identify a group of patients at risk, namely males who are older adolescents and have a BMI. I also think it raises increased awareness of the importance of cam femoral acetabular impingement and a large alpha angle, and the importance of correcting this at the time of arthroscopic surgery. The most interesting findings in this study was that cam femoral acetabular impingement with a large alpha angle was associated with articular cartilage injury, whereas pincer impingement was not. We plan on studying this further. It may very well fit with the tenets of FAI as espoused by Professor Gons, where cam FAI with the asphericity of the femoral head results in articular cartilage injury at the chondrolabral junction and may often present later and with more cartilage injury, compared to pincer impingement with overcoverage of the acetabulum. This may more frequently result in labral pathology before articular cartilage injury, and so we hope to take a deeper dive to see if that association is correct.